So what we are looking at in this section is to emphasize the same thing that we have talked about, but in this case, we are basically focusing on the blood flow through the heart. Okay, the blood flow through the heart. Of course, we hinted on that in our presentation, but now we want to basically give it more focus, especially the blood. The focus now on blood, not on how the electrical impulses are moving. So that is what we are going to look at. Okay, we already know that blood flows to the lungs and then back to the heart and then to the rest of the body parts. So how does that blood enter into? We have two types of circulations. We have two types of circulations. One is where blood is taken to is taken to the lungs, and one where the blood is taken to the rest of the body parts. So here we are. When we have the blood coming, the blood basically comes to the heart from the rest of the body parts through the superior vena cava. And this is basically systemic circulation. What we have here is systemic circulation. So what we are saying here is that blood comes from the rest of the body parts through a major vein, the superior vena cava. The superior vena cava empties that blood into the right atria. And then when the blood has accumulated in the right atria, it will flow into the right ventricle. And then you will have the ventricle also contracting to push the blood through the pulmonary artery for oxygenation. So the blood goes, and then it will return back after oxygenation from the lungs. That blood has to come back to the heart. So the pulmonary vein bring this blood back here, and then the pulmonary vein basically empties this blood into the left atrium. And now when the left ventricle contracts, pushes the blood to the rest of the body parts. So that is how blood flows in the heart. Okay, so let's go deeper into it. We basically talk about two phases. The first phase is a systole. Systole basically refers to the contraction, and then the other phase is diastole. Okay, it is very easy for you to explain the heart, or the heartbeat, or how blood is ejected using those two terminologies. We have a phase where the atria relax such that the blood comes in, and then the blood goes into the vessels, the ventricles, and then back again. We have systole, which is contractions, and then diastole, which is relaxation. Those two things happen during the cardiac cycle. Okay, so the main events are that at one point you have contraction of the atria, and then at another point you will have contraction of the ventricle. So that means that you cannot have contraction at the atria and then contraction at the ventricle at the same time. What happens is that it has to happen in an organized way such that you don't have problems with the heart. Okay, so this is what we are emphasizing, that the contraction of the atria cannot happen at the same time when you're having contraction of the ventricles. Okay, so the diastole is the relaxation. Relaxation increases the volume but reduces the pressure, so that means it gets filled. Whether you're talking about the atria or the ventricle, they get filled. Okay, that's what we are emphasizing there. So let's look at how that blood now moves systematically. So we are saying that the blood comes from the superior vena cava and enters the right atrium. Okay, so that blood comes when it is not having oxygen. It is blood that is rich in carbon dioxide. Okay, so when the pressure rises, this blood is pushed to the ventricles. Okay, the emphasis here is that naturally the contraction of the atria actually pushes a little blood into the ventricle. Naturally, much of the blood enters the ventricle without need to apply any pressure or contractions. Okay, so usually if you're resting, the amount of blood that enters the ventricle from the atria is the amount of blood that enters the atria is about 80 milliliters. Okay, if you're not exercising, but of course it can vary depending on your level of health, your level of fitness, and things like that. Okay, so now the atria has filled. Another step is that blood has to go into the ventricles, and then the ventricles contracting. So this is the second stage. Okay, so the second phase is ventricular systole. Remember, systole is contraction. So the ventricles contract. So the ventricles are filled with blood, and then they have to contract. Okay, so like we said, that there is a delay because of that atrioventricular node, if you remember that. That delay is very important. So during this phase, because it is systole, we are basically emphasizing that the ventricles are the ones that contract and then push the blood up. Okay, so in that, please, in your explanation, endeavor to talk about the extent of opening and closure of the valves. Okay, so here, if we are to go back, when we have the atria filling, that filling, it means the atrioventricular valves have to be closed as the atria is actually filling up. Okay, but the moment the pressure increases in the atria, then they will actually open. Okay, the atrioventricular valves will open, and then when they open, that's when the blood goes into the ventricles. So here, when the blood entry of the blood into the ventricles means that that entry is only able to take place because the atrioventricular valves are open. But the moment the blood has filled up in the atrioventricular, in the ventricles, the moment the blood has filled up the ventricles, then the atrioventricular valves have to close during the process of contraction of the ventricles. Okay, and then that will force the semilunar valves to open, pushing the blood into the pulmonary circulation and the systemic circulation. Systemic circulation through the aorta, pulmonary circulation through the pulmonary artery. Okay, so this is basically what we are having here. The ventricles are contracting. When they contract, they push the blood. When there is relaxation, the blood enters. So this actually happens simultaneously, that the blood enters the two atria, left and right atria, and then fills up the ventricles and then ejected out. Okay, so diastole, you have relaxation, allowing the blood to fill, and then eventually the atrioventricular valves open, and then again the blood comes out. That is through systole. So diastole, systole, diastole, systole, diastole, systole. Okay, the lap, dap, lap, dap. Okay, what is the key thing? The key features of the cardiac muscle. It has mitochondria. That means that it is energy, sufficient energy for the contraction. 2, it has intercalated discs that enable transmission of impulses very fast. Another point is that it has long refractory period. That means that there is sufficient time for it to get reorganized, if I can use that word, before another impulse comes in. Okay, that is very important, the fact that it does not get fatigued. And then the other thing is that it is myogenic, and the impulses are generated are rhythmic and regular. Okay,